Thank you, Mr. Speaker. Mr. Speaker, before I get to my presentation, I must say that my fellow Region 6 MP, I listened to him. I thought I would have had a lot of things to rebut, but there is nothing for me to rebut really, other than to say that we cannot continue. It doesn't make sense to continue fixing a bus, and when the cost of fixing the bus is more than the cost of the bus itself. I advise the honourable member to read the Auditor General's report and to be so informed. Mr. Speaker, Infectious Disease Hospital in Burabese. Again, the honourable member is my good friend. I want to advise him to travel around Burabese. Travel around Burabese and you will know that in Skeldon we have got the facility set up specifically to deal with infectious diseases, more so with COVID. New Amsterdam Hospital also has a section to deal with COVID. Building new health centers, Mr. Speaker, health centers are constructed based on the needs of the population, the catchment, the numbers of persons that you have to serve, or the distance that they have to cover. Again, I would advise the honourable member to do some reading, and he will know, he will become familiar with those things. Because we care grant to 40,000. Mr. Speaker, I've been listening to the members from the opposite side, and their suggestions and their comments are so diverse. There is no common thread that I could find. Mr. Speaker, before I go to my speech, there are a couple of things I need to clear up. One is, thanks to internet and social media, and thanks to Parliament beaming these debates live, people could hear what we are saying. And so I received a document via email from representatives from 5274 NDC, Corriverton Municipality, and Crabbe Creek NDC, that basically asked me, as the MP for Region 6, to rebut what the Honourable Member Ganesh Mahipal said. And they quoted it. They quoted that NDCs were instructed to spend their subventions on streetlights and crush and run. It was like a racket, sir. One of the streetlights cost the taxpayers 35,000 Guyana dollars, and your cell phone light is brighter than the light that was erected, on close quote, Mr. Speaker. Mr. Speaker, they asked me, first of all, to say that they live in the area, and they invite the honourable member to visit and see that the street lights are as bright as any street light in Georgetown or any that was established before. They also advised me, because some of them are council members, and they advised me that these street lights were the requests of the people of these areas, the NDCs and the municipality, and they met as councils and they made the decision, and the request was made to the ministry. This request was satisfied, and Mr. Speaker, they said that they are quite happy with it. And I would also ask the Honourable Dr. Ashley Singh to have some training sessions with the members over there. Let them understand what's program budgeting. Let them understand that if you budget for something and the money has been given, then it has to be used there, or you got to get permission to change it. So, Mr. Speaker, the 128 lights that were installed in 5274, the 97 lights that were installed in Corriverton, the 128 lights in Crabbe Creek, and the 201 lights that were installed in 5274, thanks to the government of Guyana of the day. They're all working and working well, and we have met the needs and the requests of the people. Mr. Speaker, I also have to deal with another issue. Honourable member raised issues about Region 5, health in Region 5. And Dr. Nicholson has replied. I have the information here and I could share it. There are in 2020, 2 land ambulances were purchased. In 2021, another land ambulance. Together with one that they have will become 4. New boat and engine for the work of the health department in Maracaibo. Minibus for the work of vector control department. 1 4x4 ambulance for the residents of Maracaibo. This will help when the water is very low to move the patients either to quite lower down the river, or to Linden. 1 minibus for the MCH department. Mr. Speaker, the laboratory, the honorable member said that the laboratory needed to do more tests. Well, Mr. Speaker, this is what Dr. Nicholson wrote. We continue to perform hematology, biochemistry, parasitology, urinalysis, etc. at both labs. In 2020, we saw 21,039 patients, completed 91,091 tests. In 2021, we saw 24,000 patients and completed 114,000 tests. Proof that our service has improved. This is from the RHO himself, Mr. Speaker. The region, talking about PPEs, he said that there are not enough PPEs for the people in region, for the workers in Region 5. The region currently has a 6-month supply of PPEs, all categories, and is still collecting more from MMU. The health centers actually have a surplus of PPEs that was sent to them, and we have a 3-month supply in every health center. In fact, we have to find extra storage, since now PPEs are being stored at one of the MP doctors' quarters. Mr. Speaker, the drug situation, Dr. Nicholson is the RHO of Region 5. The drug situation, in August of 2020, our supplies across the board was maximum at 50%. At this stage, we are 85% and above across the board. Vital, essential, non-essential, HIV, malaria, and TB drugs, etc. Mr. Speaker, this is the answer. I would advise that honorable member to also visit Region 5. Go talk to the RHO and the health workers, get the truth, and then come and let us talk. Monthly outreaches were done, specialist outreaches, again in Region 5. Mr. Speaker, please allow me to begin my substantial presentation. Mr. Speaker, first of all, I want to congratulate Honorable Minister Dr. Ashni Kumar Singh and team for this well put together budget. Congratulations to all the ministers, ministries, and departments for your hard work has paid off. This is not only the biggest budget, but also the best budget. And Dr. Ashni, great presentation. Mr. Speaker, let me say from the outset that I support this budget. And as a geographic MP of Region 6, I also bring the support of the residents of Region 6 in supporting this budget, and would like to inform the Honorable Minister that the residents of Region 6 say thank you. There is now a sense of optimism in Region 6 that was absent in the period 2015 to 2019. Mr. Speaker, I'm not going to go back about those taxes and the ban used tires and the ban old cars and stuff like that. We are already back on track. 3 successive PPP budgets, progressive, people-oriented, and people-centered. The 3 Ps, Mr. Speaker. But sadly, we still have to do some repair work for the tsunami that was the APNO AFC government for 5 years. We still got work to do, and I will deal a bit with that later. Mr. Speaker, I've listened for 3 straight days to presentations. I have heard a few honorable members vehemently say they will not support this budget 2022 with all the measures that it has to reduce the burden on people, improve health and education, delivery, building of infrastructure, etc. Mr. Speaker, I challenge the honorable members in the opposition who have issues supporting this budget to name even one measure, Mr. Speaker, in this budget that will negatively affect the people of Guyana, especially the poor. Name at least one. Since you can't, then you're opposing just for the sake of opposition, and there you shall stay. Mr. Speaker, we have heard some of the members of this House talk about poor handling of the COVID pandemic. Please allow me to speak a little bit about this. Mr. Speaker, starting March last year up to July last year, COVID information was a big secret. It was even bigger than the FBI and those agencies. Mr. Speaker, 2020, sorry. Mr. Speaker, imagine a test is done. The results is then taken to the Minister of Public Health, who at that time wasn't a medical doctor. That minister then decides when she is going to release that information to the medical staff who are treating the patient. Mr. Speaker, that is criminal. You know why? Because one, those medical staff don't know whether they're treating a positive patient or not. Two, those persons who were in contact with that positive patient were walking around the streets, may be positive with or without signs and symptoms, infecting other people. Mr. Speaker, over the months, we can safely say that by end of July 2020, COVID was seeded across this country. So let them not come and talk about COVID and what was happening now. You messed up at the beginning. You caused it to spread. Mr. Speaker, just a reminder that we knew we won the elections because we had our SOPs. And we were already planning, preparing, and performing as a government in waiting. We started, a committee was set up. We started producing masks, reusable masks, sending it out to the community, ensuring not only that we gave it to people to use, and that was throughout Guyana, on the coast in the hinterland, but also there was instruction how to use your mask. We had our cameras going out there advising people on how to take care to prevent getting infected. So, Mr. Speaker, in August 2020, when we took the reins of government, and in that committee, my good friend, the Honorable Frank Anthony, was a lead role. So when we took reins of government in 2020, we could have hit the ground running. We first increased the testing capacity when they used to test in single digits per day. That was the capacity. We increased it to hundreds per day. And currently we have the capacity to test thousands of persons per day. Mr. Speaker, as soon as vaccines became available, our PPP civic government invested heavily in vaccines because we knew how much it meant to save the lives of the people. Mr. Speaker, so this previous government, the APNO AFC, should be careful about bringing figures to this house where COVID is concerned. Mr. Speaker, PPE was limited, but like you heard from Region 5, we have adequate amount in stock for the next 6 months. So how was our minister handling COVID? He started every day having meetings with all the relevant personnel, the RHOs. He was sharing information every single day to the public. And we have vaccinated persons. We have the tests out there in all the regions. Mr. Speaker, I saw you show me the white pen, so let me move on. Mr. Speaker.
That white pen just says you have 2 minutes remaining in your original time, plus the extension.
Thank you, Mr. Speaker. Mr. Speaker, I was talking about the destruction that we still have to fix. Look at New Amsterdam Hospital. New Amsterdam Hospital, the entire sewage system collapsed. You know why? Because now we are finding out they were supposed to have 8 2-horsepower industrial grinder 3-phase pumps. Those were taken out over the 5 years and they were replaced by half-horsepower 110 volts domestic pumps. It got to collapse, Mr. Speaker. Now we have to fix that. The ophthalmology hospital, the large units that we have there for centralized air, for centralized AC, sorry, those units got damaged because they were using substitute parts. Now, last year we had to replace those units at a cost of over $10 million. Mr. Speaker, the management of the Amsterdam Hospital continued to find serious issues. Mr. Speaker, sugar. If you look at sugar, Mr. Speaker, those 1,300 sugar workers that have come back on the job, they are now providing meals for their families. The vendors in the market will have more business. Other small businesses would benefit. The NIS, Mr. Speaker, who we were told by the previous government, was at a critical stage. The NIS will now have more contributors with a projected infusion of approximately $253 million per annum. This is what it meant. And more than that, Mr. Speaker, sugar is not just about profits, as the last government saw it. They put profits before people. Mr. Speaker, the sugar industry, Gaisuko, now functioning. There is better drainage and irrigation in Region 6 and Region 5 because Gaisuko played an integral part in that. So people's lives and village economy is better, Mr. Speaker.
Honorable member, it's a good time to seek an extension.
Mr. Speaker, I'd like to ask that the honourable member be given 5 minutes to conclude his presentation.
Thank you, Honorable Minister Tashir. Honorable member, you may continue to your conclusion.
Mr. Speaker, I'll jump to the hinterland. Mr. Speaker, I work in the Ministry of Health, and it has been the mandate of this government, the promise in its manifesto, that we will provide better services. We'll bring the hinterland services up to the standard of the coast. And Mr. Speaker, we are well on our way to do that. Mr. Speaker, let us look at Region 9 during the period 2021. Specialist outreaches, Mr. Speaker, that included ultrasounds. It is in the manual that pregnant women should be seen at least once by the doctor and should have at least one ultrasound during the course of the pregnancy. We found women who had more than one pregnancy, more than one children, and they were more than one child, and they never saw a doctor, never had an ultrasound. So we took specialist outreaches that included ultrasound, that it included eye care, dental care, rehab, audiology, speech and language therapy, environmental health, all these things and more, we took to the villages. So, Mr. Speaker, in Region 9, all 57 villages were serviced, and that would continue this year. We not only did that, we collected a list of the persons who would need cataract surgery, who would need pterygium surgery, who would need other surgeries like hernias and hydroceles and so on. We got 45 persons with cataract and 39 with pterygium. We are going to bring these people out, Mr. Speaker, get them treated, and take them back in there. This is a caring government, Mr. Speaker. In addition to Region 9, we gave 3 ATVs, 2 4x4, and 1 2-wheel bike in 2020. In 2021, 1 minibus, 4 2-wheel bikes, 6 ATVs, 1 4x4 vehicle, and 1 ambulance. The ambulance was placed at Sand Creek. ATVs at Karasabaya, Shelton, Rukumuta, Shulinab, and Sawawariwa. Mr. Speaker, Region 1, I must refer to the presentation of Honorable Cox, MP from Region 1. If he was visiting the communities, he would have been told that at the request of the residents of Maruka, there is now a functioning X-ray. At the request of those same residents, we are completing a Tatum, we'll start surgeries. At the request of the residents of Manawarin, we have obtained an ATV that will be sent in. If the honorable member had gone to St. John, he would have known that was one of the first villages that had 100% vaccination for COVID. If the honorable member had visited Whitewater, he would have been told that at the request of the residents there, the building was expanded, moved up from a health post to a health center, has a new incinerator. Mr. Speaker, there's a whole list more, a new dental surgeon in that region. In addition, the honorable member would have known that 52 community health workers were trained in 2021, and 8 communities had a healthcare worker for the first time. For the first time, Mr. Speaker. Mr. Speaker, I'm sure the member, honorable as he is, would have mentioned these things had he visited and known of them. Mr. Speaker, here I must mention that we also did training for 62 community health workers in Region 9, and those are now across the area Again, some of the facilities, they are having a health worker for the first time. Now we are setting up permanent health facilities, permanent training facilities in Region 9 and in Region 1. And we are not only going to train CSW, Mr. Speaker, we are going to train pharmacy assistants, laboratory technicians, patient care assistants, nursing assistants. We are taking training to where it is needed, not to bring out 4 persons from there and 4 from there to Georgetown, and then we get problems for them to go back. We are training in numbers in those communities because we know the hinterland communities also deserve these opportunities, and we are making it happen, Mr. Speaker. Surgical capacity has been restored at Lethem and will soon be restored to Mabaruma. We are building surgical capacity in Aishalton. This year it will be completed in Cameron, in Maruka, in Port Kaichuma. All these facilities will be providing surgical capacity, surgical care to persons. Mr. Speaker, just recently, we heard news of discovery, CGX again. Another discovery. Mr. Speaker, is it that this government is lucky, or is it that PPPC was meant for the people of Guyana for good things to happen? Cannot just be a, by the way, Mr. Speaker. Mr. Speaker, in closing, I want to say that CGX, 1,000 jobs is already going to be created, and we bear in my exploration work will soon would be continuing. In closing, Mr. Speaker, I join with my colleagues in wishing MPs across the aisle all the best in opposition. The people of Guyana enjoy the benefits of our budgets. 3 budgets so far, Mr. Speaker. 3 budgets so far, and the government is moving further away from those sitting on the other side. By the time we present the 5th budget, government will only be a dream, a hazy dream for you, because each budget of this PPP civic government is better than the previous one. So dream on in opposition. Upon this budget, the foundation of the future of Guyana is being built. The best is yet to come. Thank you, Mr. Speaker.